We're still in the trenches and not really clear on where that's going to go.
The things I'm seeing in the hospital, this is really no joke, and I've never seen anything like it.
Right now, I have so much to offer them, but you don't know how it's going to be in the next 2-3 weeks.
In the last couple of weeks, the number of coronavirus patients has increased exponentially to now over 400,000 confirmed cases in the United States. We contacted physicians in Illinois, New York, and California to hear their perspectives. But since things are evolving so quickly, we spoke to them over the course of 3 days. Here are their diaries.
This is day number 1.
This is day 1.
Day 1 in the fight against coronavirus.
Well, we had our first patient on the floor die, which was really sad. It's tough what we're going through. That interaction with, the doctor who was taking care of that patient, and, he just kind of looked at me incredulous, and he's just like, I knew it was possible that was going to happen, but it just happened so fast. There isn't necessarily set protocols because no one knows how to deal with a pandemic. So we're really figuring a lot of stuff out on the fly.
Patients today had mostly routine chronic medical issues. Luckily, today was not like 3 days ago when we had our first highly suspected COVID-19 patient.
The greatest challenge was seeing these 2 patients. One of them was a sickly 64-year-old female, and the other one was a 26-year-old young gentleman. Both of them had similar symptoms. They were a little tough to manage just because we were understaffed today, not too many people showed up.
We're still in the trenches and not really clear on where that's going to go. We evolve day to day. We evolve hour to hour. It's been such a challenge to keep up with the ever-changing recommendations and even sometimes confusion and conflicting recommendations.
We're just not resourced appropriately for something like this. And right now, it's definitely been an uphill battle.
You see a lot of people who cough a lot. And this 26-year-old was coughing quite a bit. I had about 2 gallons. Each time I went to see him, I went to see him 4 times. So you're about 8 gallons. You've got about 8 masks. You've got 8 pairs of gloves. It's very easy to run out all this equipment that you have, whether it's masks, whether it's ventilators, and whether it's nasal cannulas to give them oxygen. I think the next challenge we're going to address is the surge that's going to be coming in the next couple of days. One of the biggest challenges is trying to calm yourself when patients come in, because almost everyone is nervous. You're the captain of the ship, so to speak, so you have to really have your whole composure there. You have to really be not get nervous at all.
The one word that seemed to resonate and seemed to be commonly expressed by most of our team was abandonment, neglect, isolation.
The rates of deaths are going to increase. We know that. We know that from Seattle. Getting prepared for that is a little scary because we're not really quite sure how much equipment we have. Right now, I have so much to offer them, but you don't know how it's going to be in the next 2-3 weeks. So when you think about that, it's a little depressing.
We're rationing our tests, so that means that they're not enough. What I have heard from just the phone conversations with health state officials is that the labs just can't keep up with the testing demand.
We really need to emphasize social distancing just because we have to limit the spread. Be smart and recognize that this is now a public health issue and we need to act collectively. This is day 2.
There's been a surge for our city of COVID cases with some mortalities too, some people who died from it. We continue to fight the fight here in the trenches.
The ICUs are getting really full. Initially, we had put all the patients who are very severe in the cardiac ICU, but now that's completely full. They've moved all patients out of the surgical and medical ICUs and created a makeshift ICU. And now those ICUs are being prepped for coronavirus overflow patients. I've never encountered a situation where you've had to create intensive care units on the fly.
We had a high no-show rate today, so we had a lot of people who just didn't come. We converted a lot of our visits to phone consults. On the good side of things, the Health and Human Service Department has waived HIPAA requirements, so we could pretty much use Skype, FaceTime to do a video visit. For me, it's a challenge to tell people to be in the front line, and I, as the Chief Medical Officer of my group, feel very responsible for people. And if I can't protect my people or my providers, it does present itself as an ethical dilemma to me to tell them to go see patients and they don't have the right protection.
Definitely one of my low moments was when I was told that we don't have enough nurses to work the night shift. Some nurses had called in sick, and we had a ratio of about 6 patients to 1 nurse, which is actually pretty high.
In a developed country, you expect to have supplies, you expect to have a system, and our system is just inadequate. We've attended several calls where they've told us to reuse our protective masks.
Today, it was kind of nuts, but we were taking care of one patient who suddenly developed a cardiac arrhythmia out of nowhere. He obviously had coronavirus, and while we're getting in the process of putting pacer pads on him, another patient starts to fall apart, and they had to intubate that patient on the other side of the floor. And you're just kind of looking like, how many shoes can drop all at once?
We've got to find other ways to work better and smarter and reconfigure how we're doing care so that we're not burning ourselves out too quickly. And we've got to be able to sustain the system.
You know, the ER is doing a better job of admitting only patients who there's a lot of concern, but just the numbers keep growing.
We have to really protect ourselves. I think my anxiety and stress level rises when I go to see patients.
The things I'm seeing in the hospital, this is really no joke, and I've never seen anything like it.
We really need to spend some time and learn from countries where they've managed to rapidly control and corral the virus and the spread, and pushing back a little bit on the expectations of healthcare providers and clinical support staff. I think we need to speak up. I think we need to find ways where we get resources as a developed country would be expected to deliver upon. And so I often wonder, with all this money that's being infused from the feds and at the state level, how much of that is going into assuring that we are actually increasing the supply of personal protective equipment.
This is day 3 of going antiviral. We had another case of confirmed COVID infection in our clinic. Staff now seems more apprehensive now that we're seeing another case, understandably so.
The volume today in the ED was low. This is partly because of the stay-at-home order that was issued by the governor about 2 days ago. So people stayed at home. What it did for us was give us more time to recuperate, arrange for things, arrange our isolation rooms, get more equipment in.
Many of us feel very scrambled because everything is changing constantly. Can't keep up with the guidelines, can't keep up with the confusion around doing phone consults, can't keep up with the constantly changing testing. Every minute was accounted for. Every minute was talking to people. Every single minute. You know, not even a chance to go to the bathroom. The greatest challenge of today was keeping providers motivated to stay in place and not panic. Was keeping them focused on the fact that we need to be here to support what we expect will be a surge.
The greatest challenge today was probably a surge of patients I received between 11:30 and noon. We received about 5 patients. All the patients had similar symptoms as coronavirus patients. They came with fever, chills, cough, runny nose, and 2 of them actually had shortness of breath. So it is an issue because we have only 2 isolation rooms in the ER, and we can only accommodate 2 of those patients at one time.
As far as the situation in the hospital, it's definitely getting crazier. Our census of patients who either have coronavirus or who are suspected of, has jumped from, I think it was 6 middle of last week to around 85 today. Existing ICUs are now only for coronavirus patients, which is nuts. I've never seen anything like it. And then on the floor, patients are just falling apart kind of left and right. It's definitely gotten real. And it's progressed faster than I thought it would. I knew it would be quick, but nothing really can prepare you for it until you actually see it.
We need to be concerned about how are we going to triage sick patients. If we got 2-3 sick patients one time and I use up my isolation rooms, what are we going to do with the other 2 or 3 patients who are actually sick?
Every time I send someone out, I get 2 more back. Patients on the floor aren't getting better as fast as I'd hope, and sometimes they're even getting worse. Patients are presenting in ways that I can't expect. They're having complications I don't foresee.
It's somewhat inevitable that we are going to see a large rise in cases. We're going to see possibly positive cases in our own facility, possibly employees.
As more and more of the hospital becomes full of coronavirus patients, how do you keep the virus from spreading internally? I think I've resigned myself to the fact that at some point I'll get sick. I'm just trying to hold on for as long as I can until we get this under control, because right now we just need bodies to take care of all these patients.
Don't go to the doctor. Call your doctor. Call your provider. Find out if you need to be there.
You know, the concepts of social isolation, really preventative measures, hand washing, being cognizant if you're sick to stay away from others, taking good care of yourself, because unless we get this under control, it's going to just deplete the resources we have. So please, everyone, be safe, take care of yourself, and take this seriously.